Tedisco.
Sure. Thank you, Commissioner, for being here and your experts in testifying. There's only one part of my family that's been vaccinated for tick-borne illnesses and Lyme disease. That's my dog, Gracie. Are we any closer, or how close can we possibly be to a type of vaccination for human beings in relationship to this?
Sure. So there's research that's been out there. In 1998 to 2001, there was a work on a vaccine, but there was a lot of problems with that, both scientifically, and there was some legal challenges that came forth, so that was pulled. The European community is now working on a vaccine. It's in the phase 1 trial, so they have about 180 individuals who are in the first part to see its safety, and then it'll move forward to phase 2 and phase 3. We need to work on this, and I recognize it would be great to have a vaccine for Lyme, but we have to also remember there are the other tick-borne illnesses like ehrlichiosis and babesiosis and others, anaplasmosis, that we also need to still continue with the necessary preventive measures on that. Vaccines, I understand the issue with your animal, but obviously with people, there's all these necessary things that we need to take to move that forward. Anything later? More that you can have?
Yeah, so vaccines are primarily developed in the private sector, and we certainly...
Doctor, for the record, would you just identify, because this is all being webcast too, so...
So, I'm Ron Limburger, Director of the Washington Center of Infectious Diseases, and just wanted to add into the Commissioner's notes that vaccine development is typically done in the private sector. We do collaborate with them when if they chose to seek us out to provide testing services. Just want to reiterate a little bit also what Dr. Zucker mentioned is, because we were talking about this earlier, is if you vaccinate against one disease and you go off into the woods and you're not concerned about ticks anymore because you know you're immune from Lyme disease, ticks harbor a lot of dangerous pathogens, and so that's such a key part of prevention that we have to keep that in mind.
Well, that brings me to another question, Commissioner. In 1979, were these other illnesses in place, or are they mutates, or are they just different illnesses that the ticks are carrying now?
Well, these diseases were around at that point as well.
In how many different diseases have we identified that a tick can carry?
Well, there are the ones I mentioned before, the 5 that I mentioned before, but there are also 4 other diseases that are out there in other parts of the country. There's one in the southern area, there's one in the Midwest part of the United States, and a couple others as well. And I will turn to the experts on how many others there are.
So even before 1979, when Lyme disease was, or even prior to that, when Lyme disease was first before it had a name and it was first being looked at, Lyme disease is thought to have been on Long Island, as far back as the 1800s, early 1900s, when Montauk knee was something that was described with regard to Native American populations at the eastern end of Long Island. It's thought that was Lyme. It's taken time as time has gone on to as surveillance kind of picks up and you wind up picking up these diseases and trying to look for causes of them. That's what led to the discovery of the pathogen that actually caused Lyme in 1979. As time has gone on, we've learned a little bit more about other illnesses. When we start to see symptoms that don't match things that we know about, we start to look, both in people and in ticks, to try and figure out, is it a new pathogen? There have been a lot of kind of microbiology and molecular techniques that have been in place that have led us to discover new pathogens. One of the big kind of fields of research right now is just not even looking for pathogens, but just looking to see what's growing in a tick's gut, what's growing in a person's gut. And in some ways, we're discovering new organisms, and you're kind of going backwards. You're trying to figure out this organism and then trying to figure out, is that organism a pathogen? So in some ways, I would expect that we may find out that there are more bacteria, viruses, parasites that may be living in ticks. It just remains to be seen whether or not any of these are going to wind up being human pathogens, and then if they are, if they're going to be significant burdens of illness, or if they may just make a small number of people ill.
24 to 48 hours. If you get the tick off you, is that supposedly safe? Or?
For most tick-borne, so tick-borne diseases can be broken up into 3 categories for the most part. Diseases that are caused by viruses, diseases that are caused by bacteria, and diseases that are caused by parasites. So Lyme disease, ehrlichiosis, anaplasmosis are all ones that are caused by bacteria. Babesiosis is a parasite. Powassan, heartland virus, Bourbon virus, they're all viral diseases. The bacterial and pathogen illnesses, typically the tick needs to be feeding on you usually for at least 24 to 36 hours, if not longer, before that tick can transmit. And it's because the parasite or the bacteria has to move within the tick before it winds up getting to the salivary glands. In the viral illnesses like Powassan, you may have heard earlier this summer that can get transmitted in as soon as 10 minutes. And it's because those viruses are basically spread throughout the tick and they're already in the salivary glands. These are all transmitted through the saliva of the tick. So when the tick starts to feed on you, the saliva goes into the wound and it basically keeps your blood from clotting. And that's how the pathogen makes its way from the tick and into you.
Okay, number one question and call I get from my constituents. Didn't see a bullseye. Maybe it's been a year or 2 years. Now they're identified with Lyme disease. They get treatment, antibiotics. They're given a lot of it. They seem to feel better. Then they tell me it's become chronic. The insurance company says, I don't want to continue to pay. We already took care of that. That's something else you're dealing with. Is this a chronic disorder, or are these potentially, or are they identified as chronic disorders that if you don't catch early and they just embed into your system, that they become chronic and there's something that you're going to have to deal with for the rest of your life potentially?
So, well, I recognize the challenges that people have had, and I've actually spoken to both patients and also people that I know who have said that they've had chronic Lyme disease with the problems. And with regards to your question about coverage, and I can speak for Medicaid that if someone has a lot of medical conditions, whether from Lyme, arthritis that occurs, or other things, those are covered. We look at this, we clearly look at, based on evidence-based practice, what needs to get covered, and we do cover things of that nature.
They do cover it?
Yeah.
You think the insurance companies do cover it?
Well, I can speak for the Medicaid side, which is the state's responsibility to cover that, and we could work with, talk to insurance companies about the coverage on the commercial side.
So there's 5 to 9 that we know of. There may be more. Are there different methodologies of treatment for each one of these things? Or is it basically the same?
So let me touch back on the previous question, if you don't mind. So with all these diseases, the earlier that you can diagnose them, the earlier they can be recognized, the earlier they can be treated, the better an outcome you potentially have with regards to kind of a full cure. One of the things that we do when it comes to trying to educate providers, for example, is to tell them how to diagnose, tell them what samples to look for to wind up getting tested, and so forth. Earliest treatment with Lyme disease is going to give you your best likelihood for a cure. You mentioned the bullseye rash. You're entirely correct that not everyone winds up getting that. And in some cases, because of the type of rash it is, it doesn't hurt, it doesn't itch, it's not raised, it's just there. If you happen to have one square in the bottom of your back, you may have it, you just may never know about it. And again, you may wind up completely missing it, you may wind up going untreated. And again, the longer you go untreated, the more difficult it is to treat later on down the road. Each of the diseases that we've talked about, particularly the ones caused by bacteria or parasites, Lyme, babesiosis, anaplasmosis, or ehrlichiosis, can be treated. The viral ones, basically what you're doing is you're treating symptoms. So something like a Powassan or one of these diseases that we don't have here in New York yet, heartland or Bourbon virus, those are ones that physicians will wind up trying to treat the symptoms. You've heard perhaps about people getting meningitis or encephalitis from Powassan. Again, what a physician there is trying to do is they're trying to reduce the swelling. They're not necessarily trying to eliminate the virus. They're basically trying to treat symptoms while your body's working to eliminate the virus itself.
So it could be a chronic situation for some people.
There definitely are if untreated, there's definitely long-term outcomes for this, for particularly Lyme disease and other illnesses as well. You do get into definitional issues with CDC and some other agencies with regards to long-term Lyme disease versus chronic Lyme as well.
Just one last question.
That's a different issue.
Since 1979, is there any deaths or how many deaths can be attributed directly to being bit by a tick in Lyme?
I guess maybe the first thing that I should wind up saying is in our capacity in communicable disease control, which is where I work, we'll investigate the case. We'll kind of learn what's going on with regard to that individual case. In certain instances, there may be illnesses where somebody will have long-term symptoms, or with a Powassan case, for example, they may wind up going into rehab. They may die in rehab 9 months later, for example, and I may not wind up hearing about that. There undoubtedly are cases of babesiosis and anaplasmosis where people have died. Lyme disease is not, in general, thought to be a disease that's fatal with the symptoms that most people get. But if people wind up getting cardiac symptoms, people have died of kind of a sudden swelling of the heart as a result of Lyme disease.
I would just add also that you have to take it within the context that sometimes someone is ill with other medical conditions and then they get infected with Lyme disease on top of that, and that's always going to be a challenge to them.
Thanks.